The fluorescent lights of St. Gertrude's Medical Center flickered softly in the late afternoon haze. The halls, normally bustling with the rhythmic pulse of nurses' footsteps and the muted beeping of machines, seemed oddly subdued that Tuesday. Patrice Williams, 39, adjusted her green scrubs and smoothed the creases of her white cardigan as she reviewed a patient's chart outside room 407. With 15 years of experience and countless commendations, she had become one of the most respected and beloved nurses in the hospital, at least among those who valued competence and compassion over hierarchy. But today, the air was heavy with something else. Tension. The door swung open behind her, and in strode Dr. Matthew Langston, 51, chief thoracic surgeon and a man whose reputation was as sharp as his scalpel. Towering, silver-templed, with piercing blue eyes and a perpetual smirk, Langston exuded authority. But behind the polished exterior was a man whose arrogance and microaggressions had quietly corroded morale among junior staff for years. "Why are you still here?" Langston's voice cut through the quiet. His tone dripped with irritation as he glanced at Patrice. "I'm updating Mrs. Radcliffe's chart, sir." Patrice responded calmly, maintaining eye contact. Langston gave a short, humorless laugh. His gaze slid to the patient lying quietly in bed, a middle-aged black woman, with close-cropped natural hair and a calm but observant demeanor. Turning back to Patrice, Langston said loudly enough for the patient and attending nurse to hear, "She's just a nurse. Let's not waste time with amateurs, Mrs. Radcliffe. A real doctor will be with you shortly." A sharp sting flashed through Patrice's chest. She felt the heat rise in her cheeks, not from shame, but from the familiar, exhausting wave of humiliation. The patient's gaze flickered, cool, sharp, and thoughtful, but she said nothing. The room fell silent. Patrice held her ground. Years of professionalism hardened her spine. She gave the patient a small, reassuring smile and quietly exited the room without responding to Langston's jab. Behind her, the whispers had already begun. Down in the nurses' break room, CNAs and RNs exchanged knowing glances. "Again?" murmured Samantha, a junior nurse. "Every time," sighed Carlos, an AR tech. "He knows exactly what he's doing." Langston's dismissiveness wasn't new. He'd been known to minimize, belittle, or outright ignore black and minority staff for years. Complaints disappeared mysteriously. HR closed files without follow-up. The unspoken rule was clear. Dr. Langston was untouchable. That afternoon, Patrice sat alone in the cafeteria, replaying the incident. Should she file a complaint again? Was it worth it? Would it make a difference this time? Meanwhile, in room 407, the patient, known to staff as simply Helena Radcliffe, slowly typed something into her phone with deliberate care, her lips pressed into a thin line. Patrice didn't want revenge. She wanted dignity, equality, and a workplace where competence wasn't overshadowed by prejudice. 4 years, she had been the silent backbone of St. Gertrude's. She had counseled grieving families, saved lives in code blues, and trained younger nurses. Yet somehow, her voice never carried weight when men like Langston spoke over her. Her objective was clear now. She had to make this public, even if it meant risking her position. What she didn't know was that Helena Radcliffe had her own objective, and far greater leverage. 2 days later, an all-staff email pinged across the hospital network. Subject: urgent, immediate ethics and compliance audit underway. Confusion spread like wildfire. Staff were summoned individually for interviews. Anonymous surveys appeared in inboxes. Department heads shuffled nervously. Whispers turned into gasps when it was announced that the patient from room 407, Helena Radcliffe, was not an ordinary patient. Her real name was Dr. Helena Pierce, Deputy Director of the National Health Equity Commission. She had been conducting an undercover audit as part of a sweeping federal investigation into hospital discrimination and staff conduct, following reports of systemic bias in several healthcare institutions. She had documented everything: the incident with Patrice, Langston's repeated patterns of humiliation. She had video, audio, and corroborating evidence from staff interviews. The bombshell dropped hard. The hospital's administration panicked. The board of directors convened emergency meetings. Dr. Langston was placed on administrative leave, stripped of patient privileges pending investigation. Over the following weeks, patterns of abuse surfaced, subtle jabs, and outright discrimination. The board unanimously voted to revoke Dr. Langston's medical license indefinitely. The day Patrice was promoted, she returned to room 407, now empty. She sat on the freshly made bed, running her hand along the crisp sheet where Dr. Pierce had once lain. Her phone buzzed. A text from Dr. Helena Pierce. Change starts small. You built something bigger than yourself. Be proud. Tears welled in Patrice's eyes. For the first time in her career, she allowed herself to breathe fully. By the first anniversary of the investigation, St. Gertrude's looked different. The hospital established the Patrice Williams Fellowship for Nursing Leadership, a program designed to uplift and empower minority nurses pursuing leadership roles. Each year, 5 fellows received full tuition support, mentorship, and guaranteed leadership positions within the hospital network upon completion. The inaugural class featured nurses from underrepresented backgrounds, Black, Hispanic, Indigenous, and immigrant communities, each with stories of quiet perseverance like Patrice's. But the changes weren't just symbolic. Mandatory racial bias and ethics training became a requirement for every staff member, from janitorial to surgical. Patrice, now the director of nursing development, worked closely with Dr. Helena Pierce, who accepted an honorary advisory role, to tailor workshops that emphasized both data-driven disparities and human-centered empathy. Wards that had once operated in quiet segregation, minority nurses subtly steered to lower resource departments, were now integrated, resourced equally, and supervised under a zero-tolerance discrimination policy. Anonymous reporting channels were reinforced, with outside oversight ensuring complaints could no longer be silenced internally. Visually, the hospital transformed too. Portraits of diverse medical pioneers, like Dr. Rebecca Lee Crumpler, Dr. Charles Drew, and Nurse Mary Eliza Mahoney, now lined the main hallway, a reminder to all who entered that medicine had always been shaped by people of all colors, even when history forgot their names. Patrice herself had become something of a quiet symbol, a reluctant hero. On her office wall hung a framed quote, gifted by Dr. Pierce. "Justice is what love looks like in public." Dr. Cornell West. Beyond the hospital, ripples spread across Milwaukee County and Wisconsin. Other hospitals took note of St. Gertrude's reforms and began implementing similar fellowships and reporting frameworks. The Wisconsin Medical Board issued new statewide guidelines emphasizing racial equity in patient care delivery. Within months, hospitals from Madison to Green Bay adopted bias screening protocols in emergency and cardiology departments, the very areas where Claire's earlier warnings and Langston's dismissals had cost lives. Patrice, who had never aspired to public speaking, now found herself keynoting medical ethics conferences and nursing summits, her voice steady but never boastful. Change, she often told audiences, isn't about heroes. It's about communities deciding that silence is no longer safety. On a crisp March afternoon, exactly 1 year after Langston's license had been revoked, Patrice walked the hospital corridors, her green cardigan brushing softly against her side, a nod to her steady, grounded presence. She paused outside room 407, now converted into a staff reflection lounge, and stepped inside. On one wall, etched into glass above a small fountain, were the names of staff members who had courageously come forward during the investigation. Patrice's name was among them. A soft voice behind her spoke. "You made this happen, you know?" It was Carlos Mendez, her longtime colleague and friend. He smiled warmly, setting down 2 coffee cups and handing her one. Patrice shook her head modestly. "No, we all did." Carlos chuckled. "Still, doesn't hurt to have a reminder." They sat quietly, the gentle sound of water mingling with distant hospital beeps. A moment of stillness in a place that once overflowed with hidden tensions. On April 2nd, Helena Pierce returned for a formal ceremony. Before an auditorium filled with healthcare workers, she embraced Patrice on stage and announced a new national initiative, the Pierce Williams Coalition for Health Equity, a nationwide task force aimed at ending racial disparities in healthcare systems across the U.S., modeled directly after the success at St. Gertrude's. Patrice, taking the podium, looked over the crowd. Familiar faces, new allies, former skeptics. Her voice, soft yet commanding, echoed clearly. No system changes overnight, and no community heals without scars. But if we keep choosing to see each other fully, not as titles, not as colors, but as people, then no humiliation, no injustice will go unchallenged ever again. The crowd rose in standing ovation. St. Gertrude's wasn't perfect. It never would be. But it was awake now, and vigilant. Patrice walked home that evening under the soft gold of sunset, her stethoscope swinging gently at her side. A small reminder of the nurse who once stood quietly in room 407 and chose not to fight back in anger, but to stand forward in truth. And in doing so, she changed everything. If the story moved you, don't just watch, be part of the change. Hit that like button to honor brave voices like Patrice's. Subscribe for more true stories that remind us how courage can transform communities. And tell us in the comments, have you ever witnessed quiet injustice in your workplace? Your voice matters. Share this video because together we can make sure dignity and justice are never silenced again.